Are you feeling overwhelmed by Medicare right now? If so, you're definitely not the only one. Medicare is dominating the news cycle. Your phone is probably ringing off the hook with calls, and advertisements are flooding every screen and radio station. But what's really happening with Medicare, and why does it matter so much? Today, we're going to break down everything you need to know about Medicare enrollment periods: AEP, OEP, IEP, and SEP. I know that sounds like alphabet soup, but stick with me. By the end of this guide, you'll understand exactly what each of these means, why they matter, and most importantly, how they affect you or your loved ones. Here's the thing. We're currently in the middle of one of the most critical windows for Medicare beneficiaries. This isn't just another routine period. It's a time when millions of Americans need to make decisions that will impact their healthcare and finances for the entire upcoming year. Let me be completely honest with you. I'm not just talking about this because everyone else is. I'm talking about it because I've lived it. I've been a beneficiary myself for years now, and I learned some expensive lessons the hard way. Lessons that cost me thousands of dollars because I didn't understand how these enrollment periods worked. You see, a few years back, I made the classic mistake. I assumed my plan was fine. I thought nothing changed last year, so I'm probably good. Wrong. Dead wrong. When I needed to see a specialist, I discovered that my coverage had shifted. My provider was now out of network, and suddenly I was facing bills that made my stomach drop. Out-of-network charges aren't just expensive, they can be financially devastating. That experience fundamentally changed how I approach Medicare, and it's why I'm so passionate about making sure others don't fall into the same trap. Right now, as we speak, we're in the Medicare Annual Enrollment period, commonly called AEP. This is the Super Bowl of Medicare enrollment periods. It runs from October 15th through December 7th every single year, giving you roughly 7 weeks to make critical decisions. During this window, the floodgates open. Every single person on Medicare, all 70 million beneficiaries, has the opportunity to make changes to their coverage. You can switch from original Medicare to Medicare Advantage, or vice versa. You can change your Part D prescription drug plan. You can modify your Medigap supplemental coverage. You can enroll if you missed previous opportunities. Now, you might be thinking, but I love my 2025 plan. Why would I change anything? Here's what you need to understand. The plan you love today is almost certainly changing for 2026. I'm not exaggerating when I say that plans change dramatically from year to year. Coverage networks shift, costs adjust, benefits get added or removed, prescription formularies change, your favorite doctor might suddenly be out of network. That medication you depend on might no longer be covered at the same level or at all. The reality is that insurance companies reconfigure their offerings annually, and what worked perfectly last year might be completely inadequate next year. This is why healthcare advocates across the country are sounding the alarm right now. This brief window is your chance, your only guaranteed chance for most people, to ensure you're properly protected for the year ahead. Let's tackle these enrollment periods one by one because understanding them is crucial to navigating Medicare successfully. AEP, Annual Enrollment Period, October 15th to December 7th. We've already touched on this one, but it bears repeating. The annual enrollment period is the most flexible and comprehensive enrollment window available to Medicare beneficiaries. Think of it as open season. Everyone is eligible to make changes regardless of their current coverage situation. During AEP, you can switch from original Medicare to Medicare Advantage, move from Medicare Advantage back to original Medicare, switch from one Medicare Advantage plan to another, add, drop, or change your Part D prescription drug coverage, enroll in Medicare Part A and or Part B. If you missed earlier opportunities, the changes you make during AEP take effect on January 1st of the following year. So decisions made during this current period will determine your coverage starting January 1st, 2026. OEP, Open Enrollment Period, January 1st to March 31st. Now, this one trips people up because the name sounds similar to AEP, but it's actually quite different. The open enrollment period, sometimes called the Medicare Advantage Open Enrollment Period, runs from January 1st through March 31st each year. Here's the key distinction. OEP is exclusively for people who are already enrolled in a Medicare Advantage plan. If you have original Medicare, this period doesn't apply to you. During OEP, Medicare Advantage beneficiaries get one additional chance to switch to a different Medicare Advantage plan, drop their Medicare Advantage coverage, and return to original Medicare, add a Part D prescription drug plan, if switching back to original Medicare. Think of OEP as a safety net. Maybe you enrolled in a Medicare Advantage plan during AEP, but after using it for a month or two, you realized it's not working for you. OEP gives you one more opportunity to make adjustments. Let me share some context here. About half of all Medicare beneficiaries, roughly 35 million people, are enrolled in Medicare Advantage plans, also known as Medicare Part C. The other half stick with original Medicare, sometimes supplemented with Medigap policies and Part D drug coverage. It's roughly a 50-50 split, though the exact numbers fluctuate year to year. Understanding which category you fall into helps you know which enrollment periods are relevant to your situation. IEP, Initial Enrollment Period, 7-month window around your 65th birthday. The initial enrollment period is where everyone's Medicare journey begins, assuming you're turning 65 and newly eligible for Medicare. Here's how IEP works. You get a 7-month window that brackets your 65th birthday. Specifically, 3 months before the month you turn 65, the month you turn 65, 3 months after the month you turn 65. So if your 65th birthday is in June, your IEP runs from March 1st through September 30th. During this time, you need to enroll in Medicare Part A and Part B, and you can also sign up for Part D and/or a Medicare Advantage plan if you choose. Now, here's something crucial about timing that many people miss. When you enroll within your IEP affects when your coverage actually starts. If you enroll during the 3 months before your birthday month, your coverage begins on the first day of your birthday month. Using our June birthday example, if you enroll any time between March and May, your coverage starts June 1st. If you enroll during your birthday month, coverage starts the following month. Enroll in June, coverage begins July 1st. If you wait until the months after your birthday, there's a longer delay, and you might also face late enrollment penalties that last for as long as you have Medicare. The smartest move? Enroll during those 3 months before your birthday month. That way, you have seamless coverage starting exactly when you turn 65 with no gaps and no penalties. Missing your IEP can be costly. If you don't enroll when you're first eligible and you don't have other qualifying coverage like through a current employer, you'll face late enrollment penalties. For Part B, that penalty is 10% of the standard premium for each full 12-month period you were eligible but didn't enroll, and it lasts for as long as you have Part B. For Part D, there's a separate penalty that compounds over time. If you do miss your IEP, you'll typically need to wait until the next annual enrollment period to sign up, which could mean months without coverage. SEP, Special Enrollment Period, varies, typically 8 months. Special enrollment periods are exactly what they sound like, special circumstances that open up an enrollment window outside of the standard periods we've discussed. The most common SEP is triggered when you lose other health coverage. For example, you retire and lose your employer-sponsored health insurance. Your spouse retires and you lose coverage under their employer plan. You lose coverage through COBRA. Your insurance company stops serving your area. In most cases, this gives you an 8-month window to enroll in Medicare without penalty. The key is to act within that time frame. Other qualifying life events can also trigger a SEP. Moving to a new address, particularly if you're moving across county or state lines, generally needs to be a substantial move, usually 50+ miles or to a new service area. Moving into or out of a nursing home, qualifying for Medicaid, losing eligibility for extra help with prescription drug costs. Your plan's contract with Medicare is ending. Some SEPs are longer, some are shorter, depending on your specific situation. The important thing is recognizing when you qualify for a SEP because it allows you to make coverage changes outside the normal enrollment periods. Let me explain why I keep emphasizing that you need to review your coverage every single year during AEP, even if you're happy with your current plan. Insurance companies are businesses. They analyze their costs, adjust their networks, renegotiate with healthcare providers, and reconfigure their plans annually to remain profitable. What this means for you is that your plan's benefits, costs, and coverage networks can, and likely will, change significantly from one year to the next. Your premium might increase. Your deductible could change. Your out-of-pocket maximum might go up. The copays for your medications could skyrocket. Your favorite doctor might no longer be in network. The hospital you prefer might get dropped from the plan's network. Specific services that were covered might be eliminated or reduced. These aren't small changes. I'm talking about differences that could cost you thousands of dollars or prevent you from accessing the care you need. And here's the kicker. If you don't review and make changes during AEP, you're locked into whatever changes your insurance company makes. You're stuck for the entire year, except in the limited circumstances that qualify for a special enrollment period. Let me paint you a picture of what happens when people don't take action during AEP. Every single year, millions of Medicare beneficiaries simply do nothing. They receive notices about plan changes in the mail, they see them in emails, and they ignore them or file them away thinking, "I'll deal with that later." Then December 7th passes, AEP closes, and they're locked in. Come January, reality hits. A woman in Florida discovers her insulin copay jumped from $35 to $200 per month because the formulary changed. A couple in Ohio finds out their preferred cancer treatment center is no longer in network. A veteran in Texas learns that his Part D plan no longer covers 2 of his essential medications at all. These aren't hypothetical scenarios. These are real situations that happen to real people every single year. And the financial and health consequences can be severe. Compare that to the alternative, spending 15 to 20 minutes during AEP to review your options and ensure you have the best coverage for your needs. When you put it that way, the choice seems obvious, doesn't it? Here's something most people don't realize. You don't have to figure all of this out by yourself. There are resources available to help you navigate Medicare enrollment, and many of them are completely free. Medicare has thousands of plans across the country, literally over 24,000 different options when you account for all the variations by region. Comparing them all manually would be overwhelming and time-consuming. That's where Medicare advisors and licensed insurance agents come in. These professionals have access to comprehensive databases that can compare plans based on your specific needs, your current medications and their costs across different plans, your preferred doctors and hospitals and which networks they're in, your healthcare needs and priorities, your budget and financial situation. A good advisor can run comparisons in minutes that would take you days or weeks to complete on your own. They can identify options you might never have found independently. And because they're compensated by the insurance companies, not by you, their services are typically free to Medicare beneficiaries. The average person who works with a Medicare advisor saves over $1,000 annually on their healthcare costs. Some save more, some save less. It depends on individual circumstances, but that's a significant amount of money for most people on fixed incomes. Beyond just saving money, working with an advisor gives you peace of mind. You're not lying awake at night wondering if you made the right choice or worrying that you missed something important. You have professional guidance and support. So what should you do right now? Here's my recommendation. If you're currently on Medicare, don't wait. We're in AEP right now, and the clock is ticking. Even if you think your plan is fine, spend a few minutes having it reviewed. The worst-case scenario is that you confirm your current plan is still the best option. The best-case scenario is that you discover significant savings or better coverage. If you're turning 65 soon, start preparing now. Don't wait until the last minute of your IEP. The earlier you start the enrollment process, the more time you have to make informed decisions. Begin researching your options at least 3 to 4 months before you turn 65. If you've experienced a qualifying life event, determine if you're eligible for a SEP and take advantage of it. Don't let the window close. If you're helping a family member, assist them in reviewing their coverage. Many seniors feel overwhelmed by Medicare and appreciate having a trusted family member help them navigate the process. Your involvement could save them significant money and ensure they have appropriate coverage. Before we wrap up, let me highlight some of the most common Medicare mistakes I see people make, assuming nothing has changed. Even if you received no notification, your plan likely changed. Always verify. Focusing only on premium costs. A plan with a lower monthly premium might have higher deductibles, co-pays, or out-of-pocket maximums that cost you more in the long run. Not checking if your doctors are in-network. Provider networks change. Always verify your preferred doctors, and hospitals are covered under any new plan you're considering. Ignoring prescription drug coverage. If you take regular medications, your drug costs should be a major factor in your decision. A plan that doesn't adequately cover your prescriptions can cost you thousands. Waiting until the last minute. Don't wait until December 6th to start reviewing your options. The earlier you begin, the less stressed you'll be and the better decisions you'll make. Going it alone when you're confused. There's no shame in asking for help. Medicare is complicated by design, and even people who work in healthcare often find it confusing. Medicare doesn't have to be a mystery. Yes, it's complex. Yes, the alphabet soup of acronyms can be confusing. But once you understand the basic framework, when you can enroll, what your options are, and where to get help, it becomes much more manageable. The most important thing you can do is stay engaged and proactive. Don't be passive about your healthcare coverage. Review it annually. Ask questions. Seek help when you need it. Make informed decisions. Your health and financial security depend on having appropriate Medicare coverage. The enrollment periods we've discussed today are your opportunities to ensure you have exactly that. Remember, AEP, October 15th to December 7th. The big one, when everyone can make changes. OEP, January 1st to March 31st. For Medicare Advantage, beneficiaries only IEP, 7 months around your 65th birthday. Your first enrollment opportunity, SEP, varies. Special circumstances that open enrollment windows. We're in AEP right now, which means you have the power to shape your healthcare coverage for 2026. Don't let this window close without taking action. Future you will thank present you for being proactive. If you have questions, reach out to Medicare Resources, contact licensed insurance advisors, or speak with your state health insurance assistance program, SHIP. These resources exist to help you. You've worked hard your entire life. You deserve healthcare coverage that protects you, supports your health needs, and doesn't break the bank. Take the time now to ensure you have exactly that. Thank you for taking the time to read this guide. I hope it's clarified Medicare enrollment for you and given you the confidence to take action. Share this information with anyone you know who might benefit from it. Your friends, family members, neighbors, or anyone else navigating Medicare. Until next time, stay informed, stay proactive, and take care of your health.